The misconception is that people think these arteries are a pipe and that cholesterol accumulates this and I have a last piece of pizza and I end up with a heart attack. It doesn't happen that way.
This is Shed Talk. Diamond Fernandes, Heart Fit Clinic, here on Shed Talk. This is something you definitely need to hear. Diamond Fernandes, thank you very much for coming on Shed Talk. I'm so excited to have you because it's taken forever to get you on here.
Yeah, it's been a little bit busy. We're just opening up more clinics and getting busy with that. So it's been
I know
fun.
you're always busy, and the thing is, and where did we first meet each other?
I want to say, I think it would have been EO back when I first got into it, like 2016.
2016, and that's when you first got into it.
Yeah, I think that's around then.
So I have to get into this because one of the greatest things about you, because you've been around, and the company that you own, Heart Fit Clinic, and it's the weirdest to own a clinic, okay?
Yeah.
As one of them, but to own a Heart Fit Clinic, why?
Well,
Like, how do you get into that?
yeah, it felt like I always know I wanted to do better. So I started my career in cardiac rehab. I'm dating myself, so it was in 1999. My father just had another heart event in 98, I think it was, and they told him, look, we're going to send you to cardiac rehab. Now, he has a history of heart disease, and he's been living with heart disease longer than he's been living without it now. So thanks to what we do in our clinic for him. But in 1998, he had another heart attack, and the cardiologist said, you're going to go to cardiac rehab. And that's where I switched, pathways, and I got into cardiac rehab. And so I started working with the cardiology group in Calgary here, and I worked with them from 1999 to 2005. And even during that time, I asked them, hey, we got to do more. We got to be able to do better for the patients. And it was very, government-focused kind of clinic where we just got to give the minimal. And I'm like, well, people want more. People want to know why they had this, and people want to be able to get into the preventative side of things. And so anyway, I had the idea of Heart Fit Clinic was born at that time, but I never really acted on it. It took me a couple more years to kind of push it off. So I got headhunted by a cardiologist in Montreal. He said, look, I'm going to open up an integrative cardiology clinic in Dubai. So I went there for a year, and I managed that program. And then I came back to Calgary, and I ended up managing a program in Kelowna for a year with the cardiology group there. And I'm like, okay, look, I got to put this away. I got some money tucked away. I want to be able to open up a clinic. And I did. And so that was in 2007. I started the Heart Fit Clinic, and it was an overnight success. So we decided to open up another clinic in 2018. I'm kidding about the overnight success. It doesn't happen overnight. You know that.
It was a heartbreak success.
Yeah. So that's how I got into it. And now we do really great heart assessments and treatments that bridge a gap in the healthcare system to prevent and reverse cardiovascular disease.
Okay, so you're talking about bridging a gap, okay?
Yeah.
Because we talk about heart, and everybody says heart disease, heart this, heart that, because of healthcare systems.
Of course,
right?
yeah.
And then all of a sudden you've created a business, okay? Does the government pay on that side, like Alberta
No,
Healthcare?
we're private care, yeah.
So private care.
Yeah.
Then
And we don't do the same thing, so it's a different. I can get into that in a moment, but yeah.
okay, well, so what is the difference?
So the misconception is that people think these arteries are a pipe, and that cholesterol accumulates this and I have a last piece of pizza and I end up with a heart attack. It doesn't happen that way. So the majority of people that have heart attacks and strokes, they actually have normal cholesterol profiles. And we don't get into the why in our healthcare system. We just think, okay, well, cholesterol is a culprit, and so we just will lower cholesterol and make sure you don't have a heart attack. And so if you go to your family doctor, it's too basic. We do archaic testing, and they love you, but unfortunately they do archaic testing to see where your risk is of a heart attack. Now, it's important. Check your blood pressure, check to see if you're diabetic. Those are all important factors, but cholesterol, it's not what causes heart disease. Inside the artery wall, it's all skin, right? Just like the skin on our face. And something has to damage that skin first, so we call that inflammation. High blood pressure and diabetes are big markers, but there are hundreds of factors that can damage the lining of the artery wall. Cholesterol is not even one of them. And when we look at that, the second thing that happens is that then cholesterol gets used up in a negative way, but we have different sizes of cholesterol. We have small and large. I like to call it tennis balls and golf balls. Tennis balls won't go through that tennis net-like lining of the artery wall. but golf balls will. So I call the golf balls are the culprits. And we find that stuff out at the HeartFit Clinic. We look at particle sizes. But then there's a third step. Imagine something slithering into the lining of the skin and you're not able to get it out with tweezers. What happens to that? It gets infected, it pusses up, and that's the third part. It gets infection. So those are the three steps that we look at when it comes to understanding cardiovascular disease. Now, there are about 110 different biomarkers that we look at when you come to the clinic like that. But we now get into the why. Like, why did someone have a heart attack? Or more importantly, why are you on this path of a heart attack or stroke? And then we can target those things and reverse cardiovascular disease. And so that's how we differ than your general physician. Your general physician loves you, but they're guided into what they can do from, they're not heart experts. And so then you go to a cardiologist, and a cardiologist loves you too, but they're designed to look for advanced stages of a problem. So if you think of it like a plumbing problem, they're looking for the plumbing problem. Or think of it like a 5-lane highway system. They're looking for, is there lane closures? Is there 4 out of 5 lane closures? And then I'll start to pay attention to it. But the majority of heart attacks, so I talked about how it builds up inside the lining of the artery wall, it builds up just like a pimple would on our face. Now, if a pimple pops on our face, no big deal. But if it pops inside an artery, there's your heart attack or stroke. And we're the only clinic to look at the artery this way because of all the testing that we do is looking at before, not after. And so a cardiologist is something you want in your back pocket if you're having that heart attack or stroke. That's important. They're life-saving, but not for a preventative side of things because they don't look at the artery like we do.
So you're dissecting the artery, and not so much cutting it apart. But when what really stands clear is that I've got an artery, and it's kind of like a pimple, and it's that little pimple that all of a sudden there's something there that could actually pop.
Yeah.
And would that cause and it kind of
a heart attack?
Cause the heart attack.
Yeah.
Because it goes through.
It kind of is like
the golf
think
ball.
of it. Yeah. So inside the lining of the artery wall is all skin. So inflammation has to happen first. Then those golf balls sliver through. And when they sliver through, they get infected. So that process builds up just like a pimple would on our face. That pimple on our face, imagine that inside the lining of the artery wall. It's not, people think it's an accumulation of cholesterol. No, it doesn't happen that. It happens inside a lining of the skin. There are many layers to the lining of the artery wall.
So it's not accumulating like all of a sudden this is going on top of this one. Like when you would see a television commercial and then they said, here's your artery.
Yeah.
And this is building up because your cholesterol is too high. But it's the inflammation of the artery that's actually swelling.
Yeah. And then it kind of irks me when people who have never had a heart attack are on cholesterol-lowering pills because that's not the culprit. You got to get into, it's sandwiched between two important things, inflammation and then the infection response. So this is why when you give cholesterol-lowering medications to people, like many people, it lowers cholesterol. Good job, you've lowered cholesterol, but that not be the culprit as to why they have a heart attack or stroke. So then what we call the number needed to treat, how many people need to be taking a medication to prevent a heart attack or stroke is so poor. It's like 100 to 150 depending on the study. If you've never had a heart attack, why am I taking this pill to lower my cholesterol if it's not the culprit? Right? And that's the key idea is it's not the culprit. There are other things to be able to do that, but we're educated, and we're educated in media, we'll call it, to be able to say, look, watch out for cholesterol. It's accumulating to this pipe. Yeah.
So then why do doctors, and they said, oh, well, you need this, it's not the clinic.
Yeah.
Okay. Like the pharmaceutical companies pushing that, say, oh, you need this cholesterol pill to lower your cholesterol because you're considered a high level. So this will just bring that down. So take this pill every day.
Yeah. And if you look at that, if you give that pill to a person every day, the ask question is, how much longer will I live? How many people need to be walking into this doctor's office to prevent a heart attack or stroke? Those are real questions that you can ask your physician to say, what are the pros and what are the cons? Because you need cholesterol everywhere. It's important for a lot of hormone function and there's so many different things. You don't want to lower cholesterol with a relatively healthy person who's never had a heart attack or stroke, right? And that's the big key is that if you've had one, at least the benefits are a little bit better, but it's not the culprit. We can lower cholesterol now. There are medications that you can make it off the chart you can take cholesterol off the chart as a risk factor to you. Yet we're still seeing heart attacks and strokes with that. So it goes beyond cholesterol is really what I'm trying to say with that. And that's why when you come to the HeartFit Clinic, we look at that process to see what's going on a little bit further.
So when you're looking deeper,
Yeah.
what do you find was one of the major culprits? And it's not cholesterol.
It's not cholesterol. I think there's a lot of genetic factors that can come into play with this. I think the list goes on, but we got to think about what is damaging that lining of the artery wall. And once we get into deeper things, there could be, like I said, there are hundreds of things that we look at. Once we see what the markers are, then we can get pinpointed and throw darts right in the bullseye to see why someone is at that part. But I think if you ask me, the first thing that we want to look at is what is damaging that lining of the artery wall.
And what would that be?
Inflammation, right? There's many things that can damage it. And then when you come to a clinic like ours, we get to doing more advanced testing because unfortunately, like I said, your cardiologist loves you and they do a stress test and they tell you, oh, your pipes are clean. And that's not what should be said. And then people who maybe even have the means to do, more advanced CT scanning of the heart, it's hard to visualize the big arteries. And so it's not the right test to do for someone who's not having any pains. And so when you come to a clinic like us, we're trying to prevent that earlier stage of artery disease because that's where it starts. That pimple can grow and grow and grow. Depends on the stability of that pimple inside the lining of the artery wall. Those are the factors that we can look at.
So what is heart disease?
Okay, so heart disease is three things. So it can be plumbing, but arteries aren't a pipe, they're a muscle. The second thing is it can also be structural. So it can be a valve problem. It could be heart failure. These are things that, unfortunately, I ended up with this, and I'll talk about in a second. And then the last thing is electrical. So electricity of the heart is where you hear people needing pacemakers or atrial fibrillation. So all three are separate pillars. Plumbing is separate than structure. Structural, it would be genetic or maybe something that infected you that caused the structural problem. And then electrical, that's different too. So, but they all can overlap with each other. Right. And so when you look at heart disease, it's either the plumbing, which is the most preventable, structure. Well, you can't really do much about that. And then electrical. And the electricity of the heart is the brain talking to the heart. So there's a lot more factors that come into play that goes beyond cardiology.
So
that's the ECG that you hear about, right?
The ECG, and you go in there. So AFib.
AFib. That's the electrical pillar.
The electrical pillar.
Yeah.
And you can live with AFib.
You can, but you also have to find out why do you have AFib, right? You would see a cardiologist, let's say if you have atrial fibrillation, you would see a cardiologist to maybe cardiovert you or ablate you, but it's a brain talking to the heart too. And so AFib can happen because of a structural problem, or it can happen because of a plumbing problem, but it also can happen from the brain talking to the heart. Remember, the electrical signal starts in the brain, comes down the spinal cord, hits the heart. So there are many factors that can affect that. It could be hormonal imbalances. It could be nutrition imbalances, electrolyte imbalances, heavy metal toxicity, genetics. There's a lot of factors that can affect that. So, yeah, when you talk about atrial fibrillation, that's something that can be talking about that way too.
And it's interesting and talk about AFib because one of my experiences with AFib is that everybody has it now. Is your Apple Watch.
Yeah.
And you look at Apple Watch has AFib on it, right? So here I am right now, and it's actually recording me Apple Watch.
Yeah.
But now your AFib comes on and says, hey, you have AFib. Here you go, get checked. And then you talk to a doctor or you talk to a clinic, and when you're going in there, I find from my experience, because I had an outbreak with an AFib hit me. And my watch went off, went to the doctor, and they said, oh, you're an AFib.
Yeah.
Here it is. Well, we're not going to paddle you out. You'll come out of it, and your blood pressure's, everything's fine.
Yeah.
Make a long story short. But it was interesting. As soon as I got the Apple Watch, I noticed AFib, but I didn't feel it. So how many people and doctors and offices are going in there that the watch has said to AFib, I got to go to the doctor right now, that they live with AFib?
To be preventative on that, you want to find out why.
But how do you,
And that's stuff that we can unpeel. You got to unpeel an onion a little bit more to find out why that is a factor to you.
So here you are in the HeartFit Clinic.
Yeah.
You own it. Been doing it because your dad.
Yeah.
And then all of a sudden, how did you had an episode?
Yeah, unfortunately, I had an episode. It was a couple of years ago, and what happened was I'm going along. I had COVID. I had a really bad bout of COVID, and it was 2021. Had a bad bout of COVID. Sorry, 2022. My apologies. Early in 2022, I couldn't get back to I run, so I couldn't get back to my activity level, and I'm like, okay, well, I'm blaming it on COVID. But then I got to a hockey game. I took my kids to a hockey game and I couldn't climb a flight of stairs. And I felt myself go into AFib.
Oh, you could feel it.
I could feel it. So I messaged, one of my colleagues and I said, look, I need an echocardiogram right away.
Sorry,
And
could you say that again?
there you go.
There you go. It,
Yeah.
it just says it again.
There
See,
you
there's
go.
our watches
Yeah.
going. Can you say that again? So that is awesome.
So I had an echocardio. I'm like at the hockey game. I'm messaging. So my AFib controlled down, but I told my son next to me, and I go, look, I might need to leave the hockey game, and you might need to go home with your uncle. And he's like, well, okay, well, he's only 9 at the time, and he was a little bit panicked, but I managed. Everything calmed down. I checked. Everything was okay. Went home.
But how did you check?
I just did a pulse check, and
okay,
I got enough experience listening
okay.
to that. So I'm like, oh gosh, I am an AFib, but then I also checked that I came out of it. And then what happened was, because I pushed myself, I was climbing this flight of stairs, and I felt, short of breath, and I felt this rhythm issue. I'm like, ooh, that's not right. And so I know enough about heart disease. So I came home, but I was being a typical guy kind of thing. My wife watches me climb a flight of stairs, and she's like, how come you can't climb a flight of stairs? You're short of breath, and you're like, what's going on? Caspian also told me, my middle son, he's like, well, you said you were going to call emergency, so let's do that right now. Like, this is important. And I said, no, I'm good. I have, I have a meeting here next week scheduled. I'm good. And she's like, no, this is not good. So she went in the room, called a couple physician friends of ours, and next thing you know, an ambulance was at my door. And so at the ambulance, when they came in, I knew I wasn't having a heart attack. So it's not the plumbing pillar, right? When we talk about heart disease, there's the plumbing, there's the structural, and then there's the electrical. Well, I was having this AFib, but that was a result of a structural problem that I didn't know I had. And what happened is I went to the hospital, and the emergency doctor said, you can go home. Everything's fine. You're not having a heart attack. And I told him, look, I kind of am in this field. I told him what I do for work. And, he'd listened to me and said, oh, this is not a big deal. And I said, well, this is a big deal. You need to do an echo. So I had to coach him what to do. I mean, I've been in this field for a long time, so I had to coach him what to do. He listened. Long story short is I ended up getting an echocardiogram, but it was the next morning. So everything calmed down at that time. I was good. I wasn't having a heart attack. And I told him, look, you're trying to tell me I'm good to go. I go skiing in the backcountry once a year, and I'm like completely remote. And I told him, you think I'm okay to do that? And I obviously knew I wasn't. And he's like, well, maybe we need to go look this further. And so that's where I coached him to kind of help that. But the sad part is he would have let a layperson go home.
Would not know any better.
Would not know any better, right? And so anyway, and that's where you hear the people dropping dead of a heart event at the hockey game, or, out in the backcountry, fit people dropping. That's why, right? Because you don't get into, I would have pushed myself to heart failure and then collapsed. That's unfortunately what would have happened. But I was on top of it. I knew what I had to do. I had an echo the next day, and the cardiologist said, oh, I know your clinic, and Diamond, I'm going to have to tell you some bad news. And I already could see it on there. And I go, well, let's try and do some non-invasive. And he goes, no, we need to do surgery. And so I'm like, surgery? And so I ended up going through a battery of tests, and I ended up with open heart surgery a week later. And so it was to repair a valve. The valves are supposed to come together. And because I had COVID, which is a viral infection, it ruptured all the cords. And so the valve was not working. So now I had to do surgery. So I did minimally invasive surgery, which doesn't mean it minimally hurt. It was a hard recovery. But I ended up doing minimally invasive, and now I have cords. I have Gore-Tex cords that are holding that valve together.
So what's a minimal surgery?
So they went underneath my armpit.
So you go under your arm.
Underneath the armpit, and they get to the heart from that perspective. Now, because I don't have coronary artery disease, which is the plumbing, which most people think about, which is good because that's what I was trying to prevent as a clinic. It would have been sad if I go down that. And yes, I have a family history, but I exercise. I eat very well. I take a lot of supplements to help with my artery health, and I know my targeted nutrition. So I knew my arteries were okay, but it was nice to know that from a conventional perspective. But yeah, all they needed to do, because I would have had open heart surgery, they would have opened up the sternum and it would have been easier. But anyway, I ended up with minimally invasive surgery, and I got these the Gore-Tex Gore-Tex cords in to now repair that valve, and now I'm good. But it took a long time for me to recover. Now I can get back to skiing and biking and tennis and all the things I love to do, hockey.
So here you are.
Yeah.
You own the Heart Fit Clinic.
Yeah.
And you liked it so much about the company, meaning you were a part of it to actually go through that whole experience.
Yeah. I think it was super valuable for me because I would have, and I approached the physician afterwards that I saw in emergency, and I told him, look, you're doing your job, but I want me to be an example for anybody that comes into the emergency. You got to take it seriously. Like I was 46 at the time, and you're healthy, you're fit, you look good, but you don't know what's going on. If I was complaining about a problem, you need to take it seriously. And so anyway, it was a good learning experience for him. And I've had patients. I remember having a patient who actually went to emergency 3 times before he had an actual aortic rupture. So we sent him to a cardiologist, because the best way to look at the structure of the heart is a cardiology. That's an echocardiogram, which is an ultrasound of the heart. So we sent him there, and he went from there right to the hospital to get surgery done. That's how bad it was. And he was a very fit, late 40 guy, very fit. He does this Red Bull racing and stuff like that, but he needed to have a structural repair done. And you can't dismiss this. And same thing with artery disease. We're starting to see that a lot at a younger age now. We're seeing people in their mid-40s, 50s, having heart attacks and strokes, which never happened before, right? And so we're starting to see it at an earlier age.
Would you ever see where people would actually say, hey, listen, understanding you're going to go to the doctor for a physical.
Yeah.
You're going to go and do this. You're going to go to the dentist once a year.
Yeah.
Would you use your clinic and say, you know what, I just need to
I think it's important. Like, it's a very inexpensive way to understand where your risk is of a heart attack or stroke. And I mentioned, like, your doctor loves you, but they're looking at cholesterol. Cardiologist loves you too, but they're looking for an advanced stages of disease. And even if you have advanced stages of disease, it doesn't mean that we need to go stent it and bypass it. You only want to do that in an emergency setting now. So even if you find out that you have artery disease, it doesn't mean that we need to go open this stuff up. This is where our clinic, we have these treatments where we can grow new arteries and improve blood flow and heart function, which I actually did the treatment after my surgery so that I can improve my heart. My heart function was just down to the toilet after surgery. And so I improved it. I went from 40% back to normal by doing the treatments and following what we do as a clinic, right? So I was my own patient during that time. And it took me a good 6 months to recover back to normal, but even I'd say close to a year to pushing that.
So would you recommend for people to just come in once a year just to get a maintenance check? Just say you don't have anything.
If you don't have anything, it's good to know. It's good to know at least once. And maybe I don't see you every year. If it's good, then I maybe see you every couple or 3 years, right? So
what do they call that? An ounce of prevention's a pound of cure?
Absolutely, yeah. It's always nice to know.
And you would never think about it that way when you talk about heart. As we're getting older, the population's getting older, we're getting older. As we actually talk about, as we're getting older, about our health, but nobody actually goes, well, I'm going to go to the doctor and get my heart checked, and no, I'm good health, but not realizing there's another alternative to actually check out your heart. This is just like going to the dentist and getting a cleaning.
It's important. And there are a lot of gatekeepers when it comes to seeing a cardiologist. So your GP says, okay, let me just check to see if there are any advanced risk factors, because a cardiologist doesn't want to see you unless you're symptomatic, meaning you're having something that they can deal with, maybe, right? And so this is where we get a little bit more in depth on that side of things.
Interesting. So all of a sudden it grows. All right. So here you are. You're in it. You're a lot better now.
Yeah, absolutely. Okay? I feel 100% now. Yeah.
Now, the business as a whole. Mm-hmm. Okay, now let's get as an entrepreneur.
Yeah.
How do you find being an entrepreneur in the health side of it?
It was a big learning experience because I was a clinician coming into the business, and I was a good technician, we'll call it. And after reading lots of books, and like I said, I'll be candid about it, I didn't pay myself for many years. It's just unfortunately atypical. And I was going to quit many times. And I completed my business plan, and I have a lot of great people to thank for that part of it. But, I got to learn business, and I had to go through my own understanding of that, to understand the pillars of business. As an entrepreneur, it became a little more challenging. I knew I was the type of person that I had to work for myself. I knew I didn't fit in a box in being an employee. And I knew that when I was working at Total Cardiology early in my days, because every idea I had, it was like, no, we can't do that, we can't. And I hate the word can't, because, I even tell my kids that all the time. It's not a word. It's like, hey, what's possible? Like, even a little bit of part of that, like, what can you do? Like, don't make it a can't, because I hate that part of it. So I had to learn. I had to learn to become an entrepreneur.
So being an entrepreneur, okay, and we both fight the same battle. We all fight the same war.
Yeah.
But I'm looking at it. So the businesses that I'm in, and then the business that you're in, where all of a sudden customers get upset with me because I installed the wrong railings. Okay, great. Someone goes in there and you diagnose, like, there's got to be like, is that a whole different meaning?
Yeah, and I think it's how we word it as practitioners. Like, I mean, we're going to sometimes tell people information they don't want to hear, right? And that's never a good or fun thing to be able to go through. But here's the fun part is that we can reverse everything that we see.
You can reverse anything that you can see.
Everything that we see is reversible. So if you're on this path of a heart attack or stroke, let's say you're on the train of getting that heart attack or stroke, I want to take one card at a time and get precision. When you come to a clinic like ours, we're trying to get precise. We're not trying to be generalized.
Right.
We're not trying to say, oh, your cholesterol's high, or you got high blood pressure, or you got prediabetes. No, all those are important. We talked about cholesterol already. We're trying to get into the why do you have that. That gets into understanding the biology of the artery wall, and then we're looking at key markers to show that change in progression of artery disease.
So in other words, what you're saying is that if you come in and you're on this path of heart, you can change.
Absolutely.
And I'd hear this analogy. You know what? Your heart only has 1,285 beats.
Yeah.
That's it. And then it's over. Now, how does anybody prove that?
More than that, but that's okay. But that's,
Can they say, okay, well, it doesn't matter what you do, your heart can only do that many beats, and that's the way it is?
Well, I think it's important that, you address your heart health. Because if you look at your arteries, they go everywhere. In fact, if I were to attach all your vessels together, where we're sitting right now, it would go around the world not once, not twice, but almost 3 times.
All our arteries and connect 3 times around the world.
Yeah. So if we look at that, everything goes everywhere. So your brain, that's risk of stroke, heart, kidneys, those are big vital organs that get affected. Our legs, like you can end up with peripheral artery disease or poor circulation, poor sexual function, erectile dysfunction. The arteries going to our sexual organs are a lot smaller than the ones going to our heart. So arteries go everywhere. And you need blood flow for good digestion, for everything. And so if the arteries aren't working as well, that's why gut health and artery health, that's probably another hour of talking about that. There's a big link there, right? All these things come together in understanding it. So when we are improving we're improving everything where blood flows.
Is there any one thing that you would tell somebody that's healthy to watch for, or not to eat, or to do?
One thing?
One thing to say, well, obviously, don't drink 100 beer, obviously, okay.
Yeah.
But is there one thing that you'd say, yeah, that's a big red flag, a pound of butter, and I'm just using that as an analogy.
No,
so I really want to.
If I were to pick one thing, it would be mindset.
Mindset.
Yeah. I wrote about it in my book, and that was the hidden pillar that I talk about. But it's just not. It's neglect. If you neglect something, you know your body best. You know when something's not quite right. You know when you're not quite having the energy. You know your body. So neglect would be that. It's just setting the right mindset so you can be more proactive about your heart health.
And don't do the man thing. And I use this tongue in cheek.
Oh,
I'm okay. I'll just get through it. I'll do it tomorrow or later.
Yeah. I mean, the earlier you get to it, the easier it is to reverse, right? And it's a lot of people say, I don't need to know. I don't have a family history of it. Like this, I don't have a family history like you, Diamond. I don't need to worry about it. Well, if we look at the data, 8 out of 10 people that are in the hospital are there because they put themselves there. Only 20% are there because of a genetic factor. Now, the data can be anywhere up to 93% is the highest I've seen. But, it's like, that means that only a small percentage of people are in the hospital because they have a genetic risk factor, meaning their parents had it or have a family history. The other 80% put themselves there. So find out what that risk is at 80% of those people. We would have been able to reverse that disease process. And even the genetics, you can pay attention to lifestyle and make yourself just as equal as to someone else who doesn't have a family history if you focus on lifestyle.
Interesting.
Right, so.
You know what, Diamond? Thank you very much for coming on Shed Talk.
No problem.
This is one of those things that are deep to our hearts.
Yeah.
And thanks for coming on board.
Appreciate it. Yeah, thanks so much.
Thank you.
Yeah.
Now you know. Shed Talk.